1017 FM and 710 Keel. Robert J. Wright and Aaron McCarty in studio for another segment. Dr. Martha Whyte, she is Regional Director for the State Office of Public Health. And David Langston, the first man in America to have coronavirus. I'm helping you get some endorsement money here, buddy.
Yeah,
you and me.
Yeah,
I'm David's agent. Good work.
Martha, I've got to go to those CDC guidelines and recommendations for reopening schools. And we talked a little bit about it, but a deal breaker for most superintendents, and we've talked to Cade Brumley, who's now the head honcho, the head cheese in charge. We've talked to Dr. Gorey and others. The limitations on school buses, we already don't have enough school buses. And then when you say now you can put 15 kids on a school bus, you can't have school if you can't transport them to school. Is that CDC, is it a, we hope y'all do this, or is it a, you guys really need to seriously consider this?
Or was it put in place, we're going to make rules that nobody can enforce, so we're destined to fail? We don't want you to have school, but we don't want to come out and say it, so we're going to make rules that you can't possibly follow.
No, I mean, I think the rules are they're guidelines because they don't have the ability to mandate. That's not their role. But they are saying, based on how infectious this is what you need to do to truly protect everyone that will be on that bus. Now, sometimes things come down to the point where you can or cannot do something, and you have to look at risk versus benefits. And so if we, that's what the school districts are going to have to look at. Is it safe to do every other seat? Is it, to stagger, to have them wear masks? And stagger, where you could increase that number. That's what we're going to have to look at. I don't think anybody's trying to make it impossible for people to do things, but looking at the science behind it, that's what you would need to do.
Okay, I want to be where David Langston is. I want to have the antibodies and get beyond it so I don't have to worry about coronavirus. So I want to go somewhere where they can.
You want to have a chicken pox party for coronavirus?
Just give me the coronavirus. Is that outrageous for me to say to you?
Yes.
Oh, let me rephrase.
Okay.
Is that stupid of her to say?
Yes.
I thought it was.
Why?
Because
I can't
tell you. Yes, you could die.
Okay, my 26-year-old son is not going to die of coronavirus.
He could die.
He could.
It's not likely, though, right?
It's highly possible. We don't know who will die and who won't. We have 92-year-olds that aren't, and that are doing great, and we have 34-year-olds that die at home.
But don't the numbers say just the opposite of that? Don't we really have? I mean, when you look at the numbers from New York State, where it's literally 1 in 10,000 chance. If you're under the age of, I think it was 40 or 50. The mortality rate was 1 in 10,000. So don't we really know more?
So if you're that one, it's 100% chance for you. I mean, you don't know who's going to be that one and who's not going to be that one. And the truth of the matter is, Well,
let me ask you the hard question. Pardon me. You're not the politician in the room? Well, you kind of have to be. There's 40 million people, less than that now, 40 million people in the United States who lost their jobs because of this. At what point you have to weigh that 1 in that 10,000 against the lives of 40 million people?
Well, and I think that's why people have pushed to open and it weighed heavily on our governor to have to close things down. I heard those conversations. It was a very difficult decision, but when you're trying to stem an infection that in our state was running rampant, that was something felt like he had to do. I agree that we have to see how we can keep this country running, but we also have to be mindful of the people that are dying. We have 150,000 people who've died.
That was a great answer, by the way.
What are you watching in Louisiana when we see all these other states now have a resurgence? What is Dr. Martha Whyte and what's Alex BU and everybody? What are they watching to say, whoa, and wave a red flag and go, hey?
Right. So they are watching some very specific things. They're watching hospitalization rates, how many people are going into the hospital with COVID, how many people are ending up on a vent with COVID, as well as how many just cases, also how much PPE we're having. They're looking at all of these vent numbers, bed numbers, PPE amount, and case rates to see, are we climbing? And they watch that every day.
You got one more question. Time to go. One more question.
Last advice to people that are listening from Dr. Martha Whyte. I know you want to talk about masks and what else we need to be doing to protect ourselves and protect those we come in contact with?
So I want to encourage people to wear their mask when they're going to be in a place where they cannot assure that they can social distance. So if you're going into a store, if you're going into a place that might be crowded, please wear your mask, because that's what's going to protect you and protect other people from you. If you're outside and you can separate, or you're in a room where you can have enough distance, you don't have to wear your mask. It doesn't have to be 24/7. Just wear it where you know that you can't protect
Would
yourself.
you tell people driving down the road in their cars
They
by themselves?
don't have to wear it.
Thank you.
You don't. Oh, and please don't wear it under your nose.
Yeah.
Oh, pull it up over the nose.
Because if you wear it under your nose or right under your mouth, you're breathing in everything else you just filtered. So you had it up here, all that air you're trying to filter, all that dirt is on the outside of that mask. So you pull it right under your nose. Now you're breathing in everything you just tried to filter.
Dr. Martha Whyte, Regional Director, State Office of Public Health, thank you very much.
Thank you.
David Langston, first astronaut to take COVID-19 into space.
Thank you.
Just gets better and better, doesn't it?
Yeah.
does,
And
man.
Dr. White's hero,
Yeah.
Oh,
In 20 seconds, tell everybody why again if they didn't hear the first segment.
because he saved my husband's life. He volunteered to donate plasma before anyone knew anything about it, and it literally saved my husband's life.
And y'all had never met until
Never
today.
never met.
So cool.
But she took care of me on the phone when I had it. So.
Ah, yeah. She's
David.
amazing.